Well, hey guys, what's up? Happy Friday. Welcome back to the Q&A. So, a while back I posted a Q&A, probably maybe over a year ago, about sweating and deodorant. I think it's titled Deodorant Q&A because at that time I was getting a lot of questions about if I could recommend a deodorant. So this video today is kind of building on that prior Q&A, so make sure you check it out. I'll list it down below in the description box. But I still continue to get a lot of questions about sweating and a condition known as hyperhidrosis, which just means excessive sweating. That's what I'm going to cover in today's video, and I'm excited because there are actually some new and emerging treatments for excessive sweating or hyperhidrosis, some of which you guys have asked me if I can speak about, so I'm going to talk about that in today's video. But starting out, I'll have to give you a little bit of background about sweat and why we sweat and why it's important. So I know you guys don't always enjoy that, but I think it's important for understanding the mechanism of how the different treatments work so that you can be informed and have better outcomes. So sweat is a physiologic mechanism to cool the body. It's really important. Sweat is delivered to the surface of the skin when we get hot. We have thermoregulatory centers in our brain, in a part of the brain called the hypothalamus. And they signal to little nerves in the skin to innervate the sweat gland and make sweat when we get hot or when we exert ourselves. And also, this pathway of activation can occur due to emotional cues. We understand that less well than cues due to heat, how that is controlled, but some people get really sweaty when they get nervous or anxious or excited, and so that can be normal as well. There are conditions in dermatology, developmental conditions in dermatology, where individuals do not have sweat glands. That's called anhidrosis. And those individuals, because they don't have the ability to cool themselves through sweat, they can actually overheat, and they have many difficulties in day-to-day life with exertion and exercise. So it's really important. But in today's video, I'm going to talk obviously about hyperhidrosis, which is excessive sweating beyond what is necessary for just physiologic cooling of the body. It's actually a very common condition. We see it a lot in dermatology, and it can occur on the palms, the soles, the face, the armpits, obviously, and really just kind of anywhere, diffusely throughout the body. It has tremendous effects on an individual's quality of life. You can imagine excessive sweating. It's embarrassing to deal with. Individuals who experience this, they find that they have to change their clothing very frequently. I mean, it's really a pain. And then for some people in certain professions, like musicians, for example, you can imagine how excessively sweaty palms are not ideal for their line of work. When the palms are too sweaty, it interferes with how well they're able to execute their scales. I'm not a musician, but you get the drift. Guitar, violin, anything that requires the hands. If you have hyperhidrosis, it's really going to impact your quality of life tremendously. The first thing you have to be aware of is there are two situations of hyperhidrosis. There's primary hyperhidrosis, which is what occurs in the majority of cases. And why that happens, we really don't know. Some people just have really, really, really sensitive sweat glands. So the slightest little stimulus from the brain heat regulatory control centers, just the sweat glands, they're just too robust. They make too much sweat for whatever reason. They're just very sensitive. So that is primary hyperhidrosis. But importantly, there's another type of hyperhidrosis called secondary hyperhidrosis, or secondary excessive sweating. And that happens as a result of either a medication, so a side effect of a medication, or it can occur in association with a variety of medical conditions. For example, hyperthyroidism, thyroid disease, certain diseases of the hormones can impact sweating and result in hyperhidrosis. There are also a variety of tumors that can contribute, unfortunately, to present with hyperhidrosis. Both both benign and malignant tumors, there are many medical conditions that present with excessive sweating. So taking a step back, if you have excessive sweating, the first step is to see your healthcare provider. The very first step is just a basic workup, physical exam, a history, and some blood work. And the goal of that is to differentiate between primary hyperhidrosis and secondary hyperhidrosis. And once secondary causes of hyperhidrosis have been ruled out, then you can proceed with treatment, how to go about dealing with the excessive sweating. Now, I emphasized at the beginning of the video what a tremendous impact that hyperhidrosis has on an individual's quality of life. Definitely not something to be taken lightly whatsoever. But excessive sweat is more than just a nuisance. It's actually problematic to your skin and to your skin overall health. Sweat, when it stays on the skin, it's actually an irritant, and when left on the skin, sweat can kind of breaks down your skin barrier and can lead to irritation, itchy rashes. It also, because it is largely water, and that water starts to evaporate, it pulls water out from your skin, and it can lead to dryness. So you have a combination of an impaired skin barrier, you have increased what's called transepidermal water loss, you have dry, irritated skin with an impaired skin barrier. And that, unfortunately, is a setup for secondary skin infections. You're more likely to have little skin infections. Not only that, when sweat is left on the skin, the bacteria that normally live on our skin start to break it down into compounds that have an odor, and that's what gives rise to body odor. So yeah, it's not ideal to have excessive sweat sitting around on the skin, and treating it is something we take very seriously in dermatology. The first line treatment is going to be, unfortunately, something you probably already tried at this point, and you're like, why is she telling me this? But I think it's important to remind you. The first line treatment is an aluminum chloride containing antiperspirant. Aluminum chloride antiperspirants work by trickling down into the sweat duct and causing a little bit of irritation in the sweat duct, and as a result the sweat duct involutes. And so these topical antiperspirants work basically by causing the little sweat duct to kind of go away. They take some time to start working, and they have to be used on an ongoing basis. Otherwise, after you stop using them, the little sweat gland that involuted and went away will just come back. So it's something that you have to keep up with. But over the counter, what you can find in the drugstore, aluminum containing antiperspirants are reasonable first line. Kicking it up a notch would be a prescription aluminum chloride hexahydrate antiperspirant containing anywhere between 15 to 30% aluminum chloride. And this actually, when done correctly, when used correctly, can be pretty effective. You can get 52% decrease in sweat after about 4 weeks of consistent use. The way to use aluminum containing antiperspirants, as I've talked about in my deodorant Q&A, so circle back to that, but just to quickly remind you, the best way to use aluminum containing antiperspirants is to put them on at night. That's when they work optimally, and I described that in that video. Unfortunately, they can be very irritating. They work by irritating the duct of the sweat gland, but they can also irritate your skin, and that's not pleasant for people. If you're already coping with sweat on the skin that's irritating, and then you go putting aluminum on, it's fueling the fire for irritation. A way to navigate that or to help lessen that is actually you can put Vaseline on the affected skin prior to applying the aluminum containing antiperspirant, not deodorant. It won't interfere with the antiperspirant outcome, and it will decrease irritation. The other thing I'll remind you is deodorant antiperspirant is not just for under the armpits. You can actually use antiperspirant on your palms and on your soles. So it's definitely worth revisiting, and something that typically at the first visit is something we go over and try and get the patient to start doing. The reason it's important to at least consider it and give it a good college try is that when other therapies are introduced to get you even more results, you're kind of going to want to continue the antiperspirant to get even better results. So it's something to, if you're not getting excessively irritated by, to train yourself to do. It can enhance the outcomes of the other therapies. Now, the other type of treatment is something called an anticholinergic. Anticholinergics are a class of medications that function by competing with the little signaling molecule called acetylcholine within the receptor on the surface of the sweat gland. So they kind of distract the sweat gland from that little signaling molecule that tells it to make sweat and cause sweat. And these can either be oral medications, or now, new and exciting, we have a line of topical anticholinergics coming out that can just be applied to the skin and you don't have to take a pill. So this is great. Oral anticholinergics have been used for a long time. Glycopyrrolate is one that I use very frequently for hyperhidrosis. And it is very effective. It unfortunately has some side effects. It doesn't just, muck up the signaling or muck up the crosstalk of that little molecule at the sweat gland. It can have effects where that molecule is acting in other areas of the body. So a common side effect is a dry mouth, dry eyes, dry nose. It can also cause constipation. So, it's important to follow up with the prescriber, obviously, discuss side effects, but it is a very safe and a standard treatment. But exciting, and coming out in the pipeline, we now have topical anticholinergics that can be applied just to the skin and you don't have to take a pill, decreasing the chances of side effects. This new topical anticholinergic that I'm talking about is something called Qbrexza is the brand name. It is glycopyrronium, so it seems very promising. It's still pretty new. I personally don't have a lot of familiarity with using it and experience using it because it is pretty new, but it seems to be pretty effective, decreasing sweat after 4 weeks of consistent use. It can be irritating, however, to the skin. That's a side effect. But it seems to be less irritating than aluminum containing antiperspirants. It is FDA approved for people 9 years of age and older, and the way that you put it on is it comes in these little wipes that you then put on the skin. After you wipe the area with the wipe, it's very important to wash your hands because you don't want that anticholinergic on your hands. You can transfer it to your eyes and cause some bad blurry vision and side effects in your eyes. So for the topicals, you have to wash your hands after applying it. But they seem very promising, and I'm really excited about them as another treatment option for individuals with hyperhidrosis outside of just topical aluminum chloride antiperspirants. This is another way, and reducing some of the chances of systemic exposure of an oral anticholinergic. Now, you still can get side effects from the Qbrexza, similar to what you would get with the oral pill, but less so. So you can get dry mouth, dry eyes. You can also get, similar to the oral pill, you can have decreased urine output. I mean, it dries you up, is the way to think about the side effects, but less so and to a lesser extent than the oral medication. But it is absorbed, and depending on the surface area that you are applying it to, if you're applying it to a broader area, then those risks are probably slightly greater. But it seems to be very well tolerated. Some older treatments that I talked about, though, that are effective and still around and still used for hyperhidrosis is something called iontophoresis. That involves submerging either the hands or the feet in a tub of tap water that has an electrical current that goes through it. Honestly, we don't really know how this works. We think it just kind of stuns the sweat glands and causes them to stop putting out so much sweat. Requires you to submerge the hands in water. And so, you know, it's kind of a pain to keep up with, but it's nice in that you can do it at home. It's not like a procedure that you have to go into the office and have performed. It is effective. We really don't know how it works that well, but that still is a treatment. It can be used on the palms and the soles. It's a little difficult though to use in other areas because it's basically a tub and it's hard to put your armpit in there. But then the other treatment that works swimmingly is Botox. I have a video on Botox, and then I also talk about it in the deodorant Q&A. But Botox is fantastic in that it actually blocks the release of that little signaling molecule from the nerve. So it works a little bit different than the anticholinergics. The anticholinergics distract the sweat gland from the little signaling molecule, whereas Botox inhibits the release of that little signaling molecule, acetylcholine. So it works a little bit differently. It works really well, for example, in the palms, the soles. Can also be used in the scalp. It can also be used for hyperhidrosis on the face. Some people who use Botox, who get Botox, many people who get Botox for cosmetic reasons on the face will note decreased sweat in the area where it is applied. So it just kind of stuns it inhibits the release of that signaling molecule from the nerve. It, unfortunately, is very expensive. Sometimes insurance will cover it, actually. So, you know, depending on what other treatments you've tried, it may be something that your doctor can write an approval letter for, and you can get covered by your insurance. But it's very expensive, and it lasts several months, but it's not permanent. And then you can develop side effects with Botox of transient, albeit not permanent, muscle weakness. So this is really important. I mentioned earlier how sweating on the palms can really affect somebody's occupation, particularly if you're like a musician or something. So that risk may be too great for you to balance with the adverse effect of the sweating. The risk of weakening of the muscles in your hands, that could also, you know, really impair, obviously, your ability to play the instrument. I used to play the violin in high school. You think I would remember some of this stuff, but no, it has left my brain. In addition to muscle weakness, it's painful as well to have the injections. It can be very painful. There are ways to kind of lessen this using ice to lessen the pain, but it's uncomfortable to have the Botox, particularly on the palms and the soles. But about 4 weeks after the Botox injections, you know, you can get anywhere from 86-90% decrease in sweat production. It's pretty substantial. And that, you know, you can imagine that in combination with an aluminum antiperspirant. I mean, you can get much better using a multimodal approach, which is why I described how sweating works. So you can see where these different treatments target different aspects of sweat production. So, you know, using different ones in combination is something that is often necessary in this condition. And then a newer treatment that I don't think I discussed in my deodorant Q&A is something called it's microwave, microwaving the skin, or Dray. This uses microwave energy to heat up the skin and to destroy the sweat glands by heating up the skin. It's very expensive, harder to get covered by insurance, but it is long lasting. So it destroys those sweat glands, and it has more of a long lasting effect than, say, Botox, for example, where you know you're gonna have to go back and get more treatment. So it can be irritating like any of these things. It's expensive. And there have been reports of sometimes one of the things that can occur is you can get some swelling in the area, and you can also get these little bumps or what are called nodules under the skin. Those are transient, they're not permanent, but it can really alarm people when they have this. But that is another newer and exciting option. And then, you know, I think I had some questions in my deodorant Q&A about lasers for hyperhidrosis. Interestingly enough, use of what's called the Indy-YAG laser, or the laser that is used for hair removal, can actually help with hyperhidrosis. It works by miniaturizing the hair follicle. That's how it works for hair, for laser hair removal, but it also can diminish and destroy, depending on the settings. It can also interfere, disrupt, destroy the sweat gland and be helpful. Side effects are hair loss in the area, and it can cause some loss of pigment depending on the settings. Then some of you have also asked me about ultrasound therapies. That is something else that can be done to destroy the sweat gland. Basically, an ultrasound is applied to the skin, and it can also destroy the sweat glands less well than microwaving them. Surgical approaches are another option, more of a last ditch. They're definitely more invasive, more risks associated with them, but you can actually have surgery to cut out the sweat glands and remove them. There are a variety of surgical techniques. I won't get into all the technicalities of those, but that is another option. It's more extreme, having surgery, so it probably wouldn't be the first line thing that would be selected. Some of these other less invasive things would be, and probably the most, in fact, it's like a last ditch treatment for hyperhidrosis. It's something called sympathectomy. And what that is there are nerves that come out of the spinal cord, they go out to the skin, they innervate the sweat glands, and a sympathectomy basically clips the nerve, and so it is pretty extreme. And it's something that can be offered, but there are many side effects. Here you're cutting off the neurologic source, and that little nerve does a lot of other things. So there are many more side effects and risks associated with that. Very, very extreme, and is like last ditch approach. So still to this day, first line therapy is going to be antiperspirant, but very exciting that we have coming down the pipeline a topical form of an anticholinergic. You can imagine, based on what I told you today, that the two in conjunction possibly could get you better results, compound with some of these other treatment options that I mentioned today. Hopefully that's helpful to you in kind of illustrating what the therapeutic landscape is like out there for hyperhidrosis. But coming back to what I said at the very beginning of this video, hyperhidrosis has profound impacts on an individual's quality of life, how they feel about themselves. So it is not something that we take lightly in dermatology. We address it, and we make sure that the individual has a good workup to make sure that there's no secondary, it's not a secondary hyperhidrosis due to a medical disease. So don't be shy about bringing this up, and there are new and emerging treatments coming out for hyperhidrosis. So I hope this Q&A was helpful to you guys in answering all of your questions out there about what's new and exciting in sweat. It's already getting hot here in Houston. And we're in March? It's already hot, so sweat is already pervasive. But anyways, I hope this video is helpful to you. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.